Hello, my name is Jessica Uherin, and I will be presenting about Hodgkin lymphoma. What is Hodgkin lymphoma? Hodgkin lymphoma, formerly referred to as Hodgkin disease, is a form of cancer that originates in the lymphatic system. The lymphatic system is a key component of the body's immune defense, which consists of a network of vessels, glands, organs, and small cell clusters known as lymph nodes, along with various other tissues. Because of how the lymphatic system is connected, Hodgkin lymphoma can impact any of these areas as well as other organs throughout the body. Though lymphomas come in broad varieties, doctors generally group them into two main categories: Hodgkin and non-Hodgkin. The Hodgkin form develops inside the B lymphocytes, which are white blood cells that help protect the body against infections. The main form of Hodgkin lymphoma is classic Hodgkin lymphoma, and here are the subtypes. We have nodular sclerosing Hodgkin lymphoma, mixed cellularity Hodgkin lymphoma, lymphocyte depleted classic Hodgkin lymphoma, and lymphocyte rich classic Hodgkin lymphoma. And here is a diagram showing the lymphatic system in the body. The epidemiology of Hodgkin lymphoma. Every year, approximately 85,000 people across the globe develop Hodgkin lymphoma, making it not a very common cancer. The death rate on averages at 25,000 a year. It majority affects young adults between the ages of 15 and 39 years old, although the risk can also increase for people over the age of 65 years old. The survival rate over 5 years is quite high, climbing up to 90% as of recent due to improved treatment outcomes. Although the exact cause of Hodgkin lymphoma is unknown, some risk factors can be if an individual has a family history of lymphoma, a weakened immune system, along with certain infections such as HIV and EBV being linked to it. Continuing the epidemiology, Hodgkin lymphoma also seems to affect males more than females, and many of the cases are recorded with white individuals, about 86.6%. The chart on the left compares the rates of deaths between males and females, with males having a higher average rate. The chart on the right shows the incident reports of different ethnicities, whites being affected the most between ages 20 to 29 years, followed by Hispanics in much later years being 70 to 79 years. What are the symptoms of Hodgkin lymphoma? There's many symptoms to look out for with Hodgkin lymphoma, including but not subject to swollen lymph nodes, fatigue, fever, night sweats, unexplained weight loss, itchy skin, chest pain, or swelling of the abdomen. If an individual experiences one or more of these symptoms at the same time, they should likely see a doctor. And here is a chart showing the different symptoms. The diagnosis. There is a variety of ways to get tested for Hodgkin lymphoma. One common way is a blood test to detect if lymphoma cells are present or to check for viruses such as HIV or EBV. The next is imaging, which can show the location of and how progressive the cancer is using CT or PET scans. The third way is by doing a biopsy, which is where doctors remove a small piece of tissue to test, usually a lymph node, to look for cancer cells. Here is a blood test, here is imaging, and here is an image showing how biopsies work. Let's discuss the genes and pathways. The development of Hodgkin lymphoma is primarily driven by specific genetic changes in signaling pathways that allow cancer cells, Hodgkin and Reed-Sternberg, is called HRS cells, or lymphocyte predominant LP cells, to survive and grow. In the picture, you can see the cancerous Reed-Sternberg cell in comparison to a normal lymphocyte, as it appears large and uncontrolled. continuing genes and pathways. In Hodgkin lymphoma, normal B cells develop genetic defects that should trigger them to self-destruct. Instead, they survive and become cancerous by altering key signaling genes and pathways. To evade the immune system, extra copies of a gene called PDL1 allow tumor cells to put surrounding T cells to sleep, while loss of B2M strips away the surface markers needed for immune cells to spot the cancer. For uncontrolled growth, mutations in JAK2 keep cell multiplication pathways permanently switched on, while defects in SOCS1 eliminate the cell's natural braking mechanism that normally shuts down those growth signals. Finally, mutations in TNFAIP3 remove a vital guardrail against tumor survival, allowing these defective cells to override self-destruction orders and continue multiplying. The immune evasion pathway is the overarching strategy cancer cells use to hide from the body's security system. It works by disabling active immune cells in the surrounding area and stripping away surface identification markers so the tumor goes unnoticed. The JAK-STAT pathway, as we discussed in other lecture videos, is the cell's main communication network for proliferation. When genetic mutations keep this network permanently active, it sends a continuous sequence of internal commands that force the cell to keep multiplying. The NFKB pathway is the primary survival circuit inside B cells. In Hodgkin lymphoma, genetic alterations turn off the natural off switches for this circuit, preventing defective B cells from undergoing programmed cell death, apoptosis, so they can survive and turn cancerous. Here are the stages of Hodgkin lymphoma. In stage 1 of Hodgkin lymphoma, the lymphoma is confined to a single localized area, such as one group of lymph nodes. In stage 2, the cancer is found in 2 or more lymph nodes. It can also apply if the cancer spreads directly from a lymph node cluster into a neighboring organ on that same side. In stage 3, the lymphoma has spread to lymph node regions on both sides of the diaphragm. This stage may also involve the spleen or nearby non-lymphatic tissue. In stage 4, the cancer has traveled beyond the lymphatic system to distant organs like the bone marrow, liver, or lungs. And here is each stage. Here we can see 2 or more lymph nodes, and then here's the diaphragm, so it is on both sides. And then we can see in stage 4, it is affecting multiple parts of the body. Let's discuss treatment of Hodgkin lymphoma. So Hodgkin lymphoma is thankfully one of the most curable types of cancer. There are multiple treatment options for individuals with varying stages of Hodgkin lymphoma. The first and most common treatment is chemotherapy, which is a systemic drug treatment that travels through the bloodstreams to locate and eliminate cancerous lymphocytes throughout the body. It serves as the main foundation of care for nearly all patients across different stages, and it is also used in many other types of cancer. The second treatment is radiation therapy, which is a targeted form of treatment that aims high-energy rays directly at specific regions where lymph nodes are swollen or affected. It works locally to destroy any lingering disease, often following a course of medication. The third treatment is immunotherapy, which is advanced therapies, including specialized antibodies and checkpoint inhibitors that train or boost the body's natural immune system to recognize, target, and fight off lymphoma cells. The fourth and last treatment is stem cell transplant, an intensive procedure typically safe for cases where the cancer has returned or proved resistant to standard therapies. It involves administering aggressive high-dose chemotherapy and subsequently replenishing the body's blood-building capacity using healthy stem cells. I've included a picture showing each type of treatment. The first one is chemotherapy, which is very common for all types of cancers. The second one is radiation therapy, which is high-energy beams are coming from this machine and targets localized areas. The third one is immunotherapy, where they are injecting it into the bloodstream to fight off the lymphocytes. Fourth one is these are a picture of stem cells, and those stem cells can help. And then lastly, here are my references for all the websites I used. I made sure that they were all academically appropriate and a lot of listed off the syllabus that we were directed to use. Thank you for watching my presentation. Goodbye.